Thank you for taking the time to consider being part of our study. It's called Changes in Metabolites Towards the End of Life. We really appreciate your help. You're invited to take part in the study, which is looking at changes in your body as your disease progresses and towards the end of life. The research is being organised by the Clatterbridge Cancer Centre, and taking part in the study will not involve or change your treatment plan. Why are we doing this research? Well, we want to look at the changes in your body as your disease progresses and towards the end of life. There's very little known about these changes in a person's body at this incredibly important time. We will use your sample to look at these changes. In the future, we may also be able to use your sample for other research, for example, to help develop various tests and or treatments, which will hopefully improve the care future patients receive. Future research may involve some genetic testing. Your participation is completely voluntary. You've been invited to participate because you are an inpatient with cancer. We believe your participation will be very valuable to our research. Your participation is completely voluntary. It's up to you to decide to join the study, and if you do, you're free to withdraw at any time without giving a reason. This will not affect the standard of care you receive. If you agree, we will need you to sign a form that gives permission for us to enter you in the study. We will write in the medical notes that you've given permission to be in the study. We will then collect a blood sample, approximately 3 mils, when you are having routine bloods done, and a urine sample. Now, if we're unable to get a blood sample done when you're having routine bloods done, we will try and then get a specific blood draw. We will aim to collect the sample 1, maximum 2 times a week. We will also need permission from you to look at your medical notes, and this will be to see what type of disease you have. If during the course of the study you become unable to provide permission to provide samples for the research study, we will seek to obtain permission for this from someone who knows you, such as a family member or a friend. This is known as a personal consultee. This person will help represent your views to indicate whether they feel you would be happy to continue to have the samples taken. The person cannot, for legal reasons, be someone who is with you in a paid capacity, excepting family members. In the event of there being no family member or friend available, a healthcare professional will be approached as a consultee. This would be a doctor or a nurse who is involved in your care, but not involved in the research study. The consultee will be given a consultee information leaflet, and if after reading this they are in agreement with you continuing in the study, they will be asked to sign a consultee declaration form. Only then would we continue with ongoing sample collection. So for this reason, we would encourage you to discuss with your family and your friends your participation in the study. All samples collected and not used in the study will be destroyed in accordance with the Human Tissue Authority. So what are the advantages and disadvantages of taking part? Well, the study could improve the care given to other patients in the future, and there should be no risk to you. However, you will not benefit directly from the study. There's the inconvenience of giving a blood sample, which may cause some minor discomfort, and the inconvenience of giving a urine sample. Who's organising the research? Well, the Clatterbridge Cancer Centre is the study sponsor. They will be using information from you and your medical records and ensure it's looked after. Clatterbridge will act as a data controller and keep identifiable information about you for 5 years after the end of the study. To ensure the information we give out is clear, we've consulted with patients and doctors, and a regional ethics committee have given this study a favourable review, meaning that they can see the benefit of the research. How will we use information about you? Well, we need to use information from your medical records for this research project. This information will include your name and NHS number. People will use this information to check your records. Researchers, for example, in a laboratory who do not need to know who you are will not be able to see your name or contact details. Your data will have a code number instead. We will keep all information about you safe and secure. Once we've finished the study, we will keep some of the data so we can check the results. We will write our reports in such a way that no one can work out that you took part in the study. What are your choices about how your information is used? You can stop being part of the study at any time without giving a reason, but we will keep information about you that we already have. We need to manage your records in a specific ways for the research to be reliable. This means that we won't be able to let you see or change the data we hold about you. Where can you find out more about this information or how your information is used? You can find out more about how we use your information at www.hra.nhs.uk/information-about-patients/. You can ask anyone off the research team, and you can send an email to Dr. Coyle, and my details are, my email is s.coyle, Coyle, at liverpool.ac.uk. What will happen if you want to stop taking part in the study? You are free to leave the study at any point, even after the doctor has taken your data. Leaving the study will not affect the treatment you receive from the direct care team. If you have any concerns once you have left the study, contact the research team for help and advice. What will happen to the results of the research study? We will publish the results to this study in a scientific medical journal. This will be after a considerable period of time following the completion of the study. What is the legal base for processing of my personal data? According to new GDPR legislation, we are required to inform you that the legal basis we are applying in order to process your personal data is that processing is necessary for the performance of a task carried out in the public interest. And that's Article 6(1)(e). As we will be collecting some data that is defined in the legislation as more sensitive, so information about ethnicity, we also need to let you know that we are applying the following condition in law, that the use of your data is necessary for scientific research purposes. If you wish to complain about any aspect of the way you've been approached or treated during the course of the study, you can contact the Patient Advice Liaison Service at their hospital. You can also contact Dr. Maria Maguire, who's the Head of Research Governance and Sponsorship in the Research and Innovation Directorate at the Clatterbridge Cancer Centre on 0151 556 5321 or on our mobile 078 24 60 9720. Where can you get more information? If you would like to take part in the study or you have further questions, please contact Dr. Seamus Coyle on email s.coyle, Coyle, at liverpool.ac.uk. Thank you. If, after some consideration, you feel you would like to join this study, then feel free to sign the consent form. Otherwise, if you have any questions, please consult the patient information sheet and ask any member of the research team.